Hello, my name is Taylor, and this is my co-host Meri. We are investigating the impacts that heavy metals, specifically arsenic, have on New England.
In an article by David Heath, Wendy Brennan explains how her family's first reaction was shock.
My eldest daughter said, "You're feeding us rat poison." I said, "Not really, but I guess essentially that is what you're doing. You're poisoning your kids," and I felt bad for not knowing it.
She isn't alone in this feeling, though. Families across New England are testing their wells and are shocked to learn the truth.
Arsenic naturally occurs in the bedrock.
That was Dr. Disney, a researcher investigating the effects of and concentrations of arsenic in drinking water. She is conducting research and spreading awareness at the MDI Biological Laboratory in Salisbury Cove, Maine, with schools across New England. What she is referring to is research that proves arsenic is a naturally occurring element in soil and bedrock in the area.
It's going to get into our well water and into our drinking water and cooking water and can affect human health.
Arsenic is a dangerous chemical. Long-term exposure to arsenic in drinking water and food can cause many different types of cancer and skin lesions, along with cardiovascular diseases and diabetes. But that isn't all.
There's some data in a paper out of Maine that shows that children exposed to arsenic in their well water have lower IQs than children that haven't been exposed.
But now you might wonder how much arsenic is in wells across New England. In New Hampshire, thanks to the Environmental Protection Agency, or the EPA, the maximum contaminant level for arsenic was changed from the typical number of 10 parts per billion that many states like Maine has to 5 parts per billion.
When we talk about maximum contaminant levels, only public water systems are mandated to have water under those maximum contaminant levels. There's no regulation of private wells.
Along with that, there's research coming out of Dartmouth College that shows that in some cases, even 1 part per billion is dangerous.
So how do we solve this issue?
I think all new building construction, especially outside of public water system served areas, should just have water filtration systems installed.
Dr. Disney explained how many families like her son believe that developers and real estate agents would tell you if their house had an arsenic issue, but that is not the case for many families.
And I also think that for whatever money we invest in that, I think that it's going to be economic savings down the road when you think about like if it impacts on child brain development, right? I mean, what does it cost to have kids in special ed?
Looking into the future, this problem will only get worse. Policies like the one in Maine that recently delegated $400,000 to help low-income families implement water filtration systems in their home need to become much more common.
I think that we can do a first pass at this by creating maps that show areas of risk due to, your proximity to an agricultural area where there was arsenical pesticides were used, or your whether you sit on top of bedrock that has high uranium or high arsenic, or whether you're near one of these sites where PFAS chemicals are spilled or applied. I think that could help us prioritize, who to help first.
It's a small step, but it makes a big impact. Adding filters will ensure that families can drink water safely at school, at home, and anywhere they go.